Good morning. It's another Wednesday. So that means it's my free pro bono Wellness Wednesday informative webinar that I make as part of giving back. I believe that healing should be for everyone. And so try to give back through information and expertise in the areas that I'm working with. For some reason, here we go. This is a very high production quality over here. Okay, so I get really excited to do these videos. I love bringing informative healing information to the masses. That's why I left the security of having a real job and work for myself now. And it's been such a wild ride. It's opened so many doors, and I can't wait to get more of the information out there. I haven't done a good job of getting information to the masses. I've been doing the work quietly for a long, long time, and I haven't had the time because in true transparency, I worked full time or was in school and did a side hustle for a long, long time. And my network knew what I was doing, but I didn't have time to put content out there. I do have content that I'm going to slowly put out there, and this is going to be part of that. So I'm pretty excited about that. So for this week, I am going to talk about one of the conditions that I frequently come across, and one that there isn't a lot of information on. That's really where I've made my career, is doing the work that nobody else wants to do and diving into where nothing else exists. I've always been an entrepreneur since I was a little kid. Funny story. I was that kid that made a chore chart for my parents, and a lot of different fees for different things. And I would spend days and hours working out intricate systems. I was 5 years old for me and my brothers. And, I'd put that on the refrigerator. And my parents was like, no, you need to go clean your room anyways. We're not paying you for it. I'm like, but here's the ROI. I've always been that way. On Facebook today, I was sharing what I thought was this funny story, trying to describe how I am the most excited person in the room about this information. And I have to realize that, because sometimes my expectations are this information is going to go viral. And it doesn't, because why it doesn't is that people have to be open and receptive to hearing the information. So they have to kind of be going through a health or a life crisis at the time, or they have to be a business that's really their goals, their strategic goals for the year are really aligned with the work that I'm doing. And so I have to realize, Shannon, you're the only one that's really excited about this, and that's okay. I'm glad that there is one person that's excited about this, because when someone does come to me, I'm still always going to be excited and hopeful that they can heal. And so with that, I'm going to share just some late breaking news. One of the conditions that I coach on most frequently is IBS. Oh, she's talking about bowels Wednesday morning. Yes. So IBS, most of IBS, I've seen anywhere between 60 and 80% of IBS is actually SIBO, or small intestinal bacterial overgrowth. And since the research is 17 years behind, it's really unfortunate. And so I have had to be the practitioner to dig into it. There are some others that I have looked to, and the research I really lean on heavily is Dr. Mark Pimentel, and then Dr. Allison Seebecker. There are two SIBO experts, and then there are some other coaches out there that are amazing. So a gutsy girl, she's really good, and then Rebecca Coombs, she's really kind of paved the way. And then that's really it. So in my area in Central Iowa, I am actually the expert, so much so that I am the researcher behind some of the protocols that physicians use. And I know that might scare individuals, but doctors are very, very busy, and they're trying to find answers, and they don't have 1,000 hours to research one health condition like I have had to. Why have I had to do that? I've had to deal with it personally, and I consistently see it for my clients. And so my clients come to me because they've gone to everyone else and they haven't been able to heal. And so that's where I've really dug in, just truly out of how do we figure this out? What are the root causes? What plays into it? I teach at Drake University in the master's program, the clinical class about all the systems of the body. So I really understand how that works and how it plays into it. And um, for me, that has been understanding how the body works and has been really transformative as to how I've healed. So I do work with individuals most frequently that they are wanting to partner with their own bodies and partner with another person and their healthcare team to heal. Here's why. So if you go to the doctor, let's say you go 4 times a year, every 3 months, you will be with your doctor for 7 minutes. So 7 minutes times four, that's 28 minutes a year that you're with your physician. Now, when you're with your physician, are you your best self? Is that you're there, you're sick, you can't remember all of the reasons that you're in there. You're very vulnerable. It's very clinical. It's kind of overstimulating the lights and sounds, and it's a lot. And so you're in there for essentially a half an hour a year, pouring your heart out to your physician. And sometimes you forget things, and your physician has to see someone very, very frequently. They have a certain number of patients that they have to see a day, and they're exhausted at the end of the day, just like every helping professional. That is why I try to get individuals to partner with their own bodies and to investigate themselves and to do research on themselves and to lean into learning as much as they can about health themselves so they can truly heal, because everyone's journey is very unique. I also am an expert in precision medicine, and a lot of times people think that I am, since I kind of lean towards the integrative and alternative medicine practices. Why? Because there's gaps there. The medical model does well in its own, but I'm the bridge from the medical model to other modalities of healing. And it's not, some people, they pigeonhole me that, and I am not. I am a researcher. I'm evidence-based. And if something else works and it's Eastern medicine, but it works, then why wouldn't you use that? With precision medicine, I'm not anti-medicine. I'm pro-medicine, but I'm pro the right medication and the right dosage for the right condition for the right person. And so that's where precision medicine fits in. So that's just a little bit of tidbit there, because I think sometimes people put me in this box that I shouldn't be in. So getting back to small intestinal bacterial overgrowth, most of the time your doctor will put you on a low FODMAP diet. Spoiler alert, a diet will not resolve SIBO. And the other thing is that your doctor a lot of the times won't tell you that it's going to take, with a right diagnosis, with the right plan, with the right team, with the right protocol, it's going to take a year to heal from this. And then you have to uncover the root causes, because for some it can be a reoccurring issue. For some root causes like adhesions, if excessive or alcohol consumption is a root cause and you're continuing to consume alcohol, that can be for celiac disease if you get gluten, or if you have hypothyroidism and your thyroid isn't optimal. These are just some ways that it can. Antibiotics and PPIs are the two biggest causes of small intestinal bacterial overgrowth. And with that, you will see 4 months after a round of antibiotics, symptoms start to express. And for people that have reoccurring SIBO, then the conversation is about using antibiotics only in life or death scenarios. So I do have some protocols as well that are alternatives to antibiotics, just because of what they contribute and what I kind of see over and over and over again. In my line of work, I see this stuff every single day. And so I work to create protocols for populations and individuals that get to the root healing. I'm not interested in a Band-Aid fix. I'm not interested in selling a supplement over and over to someone and making them dependent on me. I'm not interested in that. I'm interested in someone having true quality of life, moving on with their life so that they can be healed, healthy, and happy with their loved ones, and they have a vitality and a vibrance about them that people are asking them, what are you doing? Well, why are you feeling so good? Because when someone is showing up in the world and they're the best versions of themselves, the people around them are as well. It starts to heal the people around them. This is how we heal one another, is by working on ourselves. So that's why I'm really adamant on people working and getting to know themselves at an expert level, because your doctor doesn't have time to. So a lot of times I'll write out scripts too of how to partner with physicians, and I'm going to put more of that in the universe. All of the things that I've done and said, I'm going to try to scale it as best I can. So I'm going to start first with the small intestinal bacterial overgrowth. So physicians have been asking for it, and so I'm going to create a physician or a practitioner guide and what to do to help your populations and your patients heal. Mine is all evidence-based. I spent over 1,000 hours researching it. I've attended all the SIBO summits. I've read every single research article that's ever been written. I stay up to date and the latest and greatest with it. I've had it. I've used this. So the protocol that I'm going to put out there for free is one that I've used myself and that I have been trialing for the last 2 years, and all of my patients have healed with it. So I'm very encouraged. However, there's a caveat, because it always, my favorite answer to most questions is it depends. If someone has a reoccurring cause to SIBO, then they're gonna have SIBO often, and that's okay. That's okay for a condition to reoccur. The mindset, so being a counselor, the important piece to put out there is sometimes you have to understand that, okay, so you're going to have a reoccurring condition. So what? Then you know how to manage it. You know what to do. You know what to look for the symptoms. It's a non-issue. There's a lot of things out there that are reoccurring, and they don't have to stop people from living their best lives. But I think it's the understanding of sometimes the framework, or sometimes we need to reframe what we're saying to ourselves about a condition, and what it's going to be like. We create all these stories about how life is going to be, and then when things don't live up to those expectations, we feel like failures. And that's silly, because we don't really know what's going to go on. That's how our subconscious brain tries to fill in for the unknown. And that is where the mindset component of dealing with a chronic illness, that's where I'm also a ninja at, because I've lived it. That's where my expertise is, and I have to use my tools every day to provide hope and healing for the masses. If I don't believe it, how is that going to work? Another protocol that I'm going to put out there is a UTI protocol. This is another reoccurring condition, and one that antibiotics is used most often for. And again, I'm not anti-medication, but if you have something that's reoccurring and then antibiotics contribute to other health conditions, or genetically you should not be using antibiotics. Antibiotics contribute to so many. The overuse of antibiotics. We need them. We need antibiotics. I'm not saying that. Don't mishear me, because in life or death scenarios, they are life-saving tools, and we need that. And if anyone's like me, genetically has a problem with most antibiotics, there is a physician in town here where, and this is what I do. I have referral sources all over the world of where to get in, who to talk to, who does what. So there's a physician in town here where slowly over time, someone can build up to having a tolerance for an antibiotic if they need it for a life-saving intervention. I'm one of those people, so I've had to seek out these resources. So I'm going to put some of these, I'm really, really excited to put some of these protocols and scale them for people that are dealing with these conditions, for practitioners and for patients, and for people that are dealing with these health conditions. I'm going to do more information on SIBO, because there isn't a lot of information out there. It is a super tough condition. I believe my protocol has, I don't even want to say how many steps. It's pages of steps, because it's that complex. There's certain timings that you need to do things. There's certain testings. There's 3 kinds of it. Most physicians only look for one. The treatment is different for type 2 and type 3. What are some of the common What are some of the common symptoms of SIBO? Now, if you look at this online, if you start to research, you think, oh, I don't have all of these, so I can't have it. You can just have one of these and still have an aggressive case of this. So I do want to put that out there. So some of the symptoms are nausea, bloating, vomiting, diarrhea, weight loss, joint pain, fatigue, rashes, acne, eczema, asthma, depression, rosacea. You can also have anxiety. You can also have weight gain. Um, and these are, you can have any, these are some symptoms. I'm going to list other things that I've seen. It can increase any sort of existing mood condition, or you can see someone that didn't have anxiety or depression they could have panic attacks, OCD, just massive anxiety attacks, massive depression, itchiness, sweating, fatigue, acid reflux, food intolerances, just kind of weird systematic issues that are happening all over the place. And there can be a lot of root causes, and the root causes, I'm going to have to create a whole nother infographic myself, because they haven't added even all of the ones that I have found in the work that I do. So some of the causes and risk factors are, and you will see small intestinal bacterial growth in some of these populations. It's just par for the course. Diabetes, diverticulitis, any structural defect in the small intestine, or any abdominal surgery, an injury, a fistula, intestinal lymphoma, celiac disease, rosacea, aging, hypothyroidism. I can't say this word, scleroderma. Oh, I can't say it. I'm so sorry. And I see this condition, autoimmune conditions. You will see this. Oh, this is not all of them. This list is terrible. Sorry. There's no list that has all of the ones that I have found. Alcohol consumption. The two biggest ones are antibiotics. After 4 months after a round of antibiotics, sometimes if you start feeling a lot better on antibiotics when you're taking them, that can tell you that you actually have small intestinal bacterial overgrowth. Proton pump inhibitors, PPIs, the Prevacid. And then there's also associated complications. So malnutrition, vitamin B12 deficiency, anemia, fat malabsorption or poor absorption of fat, osteoporosis, kidney stones, and damage to the intestinal lining. Here's why I'm super passionate about it. If we don't treat SIBO, like, oh, IBS and low FODMAP diet, I'm going to do that. I'm just going to listen to my doctor. Your body will be so depleted of vitamins and minerals that you end up with an autoimmune disease and or more than that. So if you don't treat it, it ends up getting worse. And so this is where I am adamant that you treat it, that you know about it, that you tell your friends and family about it, that most of IBS is that. I have been 100% on calling it with my clients. I'm like, I'll have a short, and this is where you need to take advantage of my free 15-minute consult. Someone will call me up, text me, email, whatever. And in that amount of time, I can ask the questions and determine, oh, this is where you need to go and do a referral and get them on their way. I'm not a genius. I've had to deal with this. So mine was missed, and I had it for 13 years, at least, that I know of, probably longer than that. And it was never told to me. And it was after antibiotics that were used in labor. And I knew something was off, and I just didn't feel like myself. And it took a long time. And the more that I dug into it, I'm like, oh, nobody knows what they're doing with this, unfortunately, because it's a complex condition. And it used to be called gut dysbiosis, which it can be and it can't be. So there's, not to get into the complexity of the whole thing, but it can be, essentially you have too much of bad bacteria in your small intestine that is overgrowing. And that causes so many mood symptoms, even if it's fatigue or loss of energy, loss of vitality. When I see rosacea, like in here and here in people, I'm like, oh, that's small intestinal bacterial growth. restless leg syndrome, small intestinal bacterial growth, weight loss, extreme weight loss, an inability to lose weight. So the inverse of it can be true. There's other things that cloudy vision, dizziness, and then you'll start to get almost POTS like symptoms as well if goes on long enough. There's so many things that it also plays into. So that's where it becomes like chicken or the egg scenario. What came first, SIBO or the root cause, or is SIBO the root cause? And so that's where I work with individuals to determine what that is. I'm working with all of the integrative and holistic and functional medicine doctors where I live, and partnering with them to make sure that they have this information, and then working with their clients. They already work with my clients anyway. But I'm doing that, but I'm trying to do this so that everyone has this information, because I stay up to date on it, and to get that out there, because it can be one of those conditions where it can be completely debilitating, where someone's running into the bathroom many times throughout the day, or just doesn't have the energy, or they can't eat very many foods. They've had to limit their diet, uh, and it's just causing them the downstream effects of it. Asthma, which can just be a lot. Anyways, quickly becomes a very expensive condition too for healthcare when you look at all the attached conditions and the coexisting conditions, and then you can start to unravel it. You can start to unravel the things and realize, okay, this is something that I can manage, and here are the symptoms that I need to look for and to heal from that. So that's what I'm talking to you about on Wellness Wednesday on this Ask Me Anything, because I get this question all the time. What diet should I be eating? Should I stay away from gums forever after SIBO? Because what can happen too is when someone gets a condition like this and they have to work really hard to beat it, it becomes a very traumatic event in their life. And then they get scared to add back foods, because it's a whole thing. It's a whole process of of doing this on the front end, doing this while you're treating it, doing this afterwards, and then this for maintenance. That's essentially kind of what it looks like. And that is not what is communicated in the medical field. And it's very complex. And who's going to spend 1,000 hours? I had to, because that's what I had to do for myself to beat it. And then for the clients that I was working with, I was seeing so many root conditions and causes that caused me. I'm like, I'm not the only one dealing with this. When I dug into it, millions and millions of Americans are dealing with this condition. And many will, and kids are. And so I've treated kids, certain people and families. When you look at pregnancy, and if you go into pregnancy with a microbiome that is kind of compromised, and you're passing that on, if you do have a natural birth and you pass that on to your children, and if you use antibiotics early in a child's life, they can end up with. So I will see eczema, food intolerances with children, eczema, food intolerances, some mood disturbances very early on, which is like temper tantrums. It's hard when the little person can't communicate, but with little people, we can actually, treat through a GAPS diet scenario, a probiotic scenario, doing things like that. So some really healing ways. And when you get it earlier, when you treat children earlier, the rest of their lives are changed by this. They don't end up with an autoimmune disease. They don't end up with nutrient deficiencies. They don't end up with a chronic mental health condition when we treat the microbiome early and intervene early, and really trust your intuition. Mamas, trust your intuition. So many times women are discounted. They are, in my class that I teach at Drake, the term that I use is the hysterical woman. You go into the doctor's office and you're dismissed immediately. You've got anxiety. Well, of course you have anxiety. Anxiety is a symptom of something going wrong with you or your child, and you are with that child and yourself all day long. You know that child better than the doctor. So you are not being hysterical. You are not overreacting. You know something is wrong. And I'm adamant about this. Healthcare is a commodity and a service. And if your doctor is not willing to partner with you, now you need to use all of your communication and collaboration skills. So not going in there with you're wrong, you're out of here, that kind of a tone, but going in there armed with research, armed with education, which is not WebMD. Okay. I have been hired as a patient advocate. In Iowa, we don't have this. In many states, there are. I've been hired as a patient advocate, and I do this naturally as part of the work. So I will call a doctor, I will send them a research study. I'm hired to do this sometimes and send them the information. And so most of the time, when you have a doctor that is really truly focused on healing, lets their ego go aside and realize, maybe there's some newer research out there, and that they're allowed to do that where they're at. There are some healthcare uh, practices and they're just not allowed. They don't have the autonomy to make those types of decisions. But for the most case, the doctor isn't, they're not the problem. They're there to help. That's why they got into this line of work. Sometimes it's just a time factor, and sometimes it is who they work for, that factor. It's the healthcare system that is sick and not aligned with some of these conditions that take a lot of time to treat. I'm going to post an article that shows you how health coaches are going to save healthcare in the world. This is where we are important to work, not to be an advertisement, but this is where it's important because this condition is, the treatment is so intensive and it takes a while that you cannot go into your doctor every week and if you have questions and all of that. But if you have a health coach that you're working with, that's where it makes the most sense to spend your money. The other thing is that your doctor can write a prescription for a health coach for someone like me, and they can say this person has hypothyroidism. Shannon's going to be their hypothyroidism coach. Write a letter of medical necessity that you can have, and then we can go through that process where you can use your flexible spending, your HSA or your HRA dollars with some insurance plans. Now, even if your insurance doesn't take that, if you invest in yourself, it'll be the best money that you've ever spent. A lot of times people hold themselves back from investing into a health coach, but they never get well. They end up having a lot of sick days. They end up not being able to show up to family events and being there and present for their children. And when you invest into healing and you heal, then that return on investment is tenfold. You're able to show up in your life. You're able to heal others. You're able to just be a productive human being in society. That's a really great move. There's a lot of people that that's where I help teach people where to use their healthcare dollars most effectively. Use this for that. Don't have this testing here, have this testing there to try to save money. So I'm a money saving opportunity. And truly, the people that I work with in 3 to 6 sessions, most of the time, they're on their way. They have the information about themselves and about their health condition to move on with their lives, and they don't need me anymore. That's the goal, right? Not to need me anymore, which is the opposite of the medical model. That's what I'm here to do. Okay. That's what I'm talking about today. I am going to spend the next week or so putting together these plans, getting them out there and available for purchase, and making some changes with my business so that I can sell things online. And that's where I'm going to be busy doing the work so I can get this information out there. I'm going to share more information about the toolkits I'm going to be putting out there, more information about small intestinal bacterial growth, which most likely is often diagnosed as IBS, UTIs, all of these other conditions that I've coached on for years. I'm going to try to put out the plans that I have for both sides as I do research in the different areas, and then answer questions along the way. So hit me up on all the social media platforms. I'm on Facebook. I'm here. I'm on Twitter. I'm on LinkedIn. I put stuff on Pinterest. I don't know if anybody looks there, and then Instagram too. So paleo counselor at all of them except for in Twitter, which is paleo counselor, and my website, thepaleocounselor.com. You'll be seeing my cards in town at local offices, and I'm going to be doing more speaking events and continuing to write and get more content out there. Okay, guys, I will talk to you later. And that's it. If I can end this. Oh, here we go. Here we go. Oof.